Davis.
Thank you, Mr Deputy Speaker. I welcome this bill and particularly its intentions to better integrate health and social care in England. As Vice Chair of the APPG on obesity, I'm also pleased to see the introduction of restrictions on advertising for high fat, salt and sugar products online and on television before 9 p.m. I would, however, emphasise that there needs to be a level playing field between the two. And as a member of the Health and Social Care Select Committee, I endorse the findings of our inquiry into the preceding white paper, especially its comments on social care provision and workforce planning. And I hope that these matters can be addressed as this bill and indeed as this year progresses. But Mr Deputy Speaker, this bill also provides the opportunity to address some of the disparities in healthcare provision across the United Kingdom. Further to my constructive engagement with colleagues at DHSC, I hope that my honourable friend will consider 4 proposals. First, we should mandate the collection of an agreed set of UK-wide directly comparable data on NHS performance and outcomes for clinical and research purposes. I'm already engaging with the ONS on how this could work in practice and believe that this bill could have an important enabling role to play. Second, data interoperability must be improved. It's unacceptable that the health service in Wales cannot often communicate in a fit-for-purpose way with services in England and vice versa. Third, my direct experience of working within the NHS leads me to feel strongly that inspection, safety and audit mechanisms should be introduced at a national level to ensure a minimum standard of care for all British citizens. Those who are managing inferior services must be able to learn lessons from more effectively run areas and ultimately be held to account. Finally, Mr Deputy Speaker, I hope this bill can be used to provide equal access and choice to secondary and tertiary healthcare services across the country, regardless of where in Britain they live. My constituent Ian Kitely was diagnosed with cancer in 2015. As a result of his treatment, he developed problems with his vision and required cataract surgery in both eyes. Like so many in North Wales, when he was advised of a 2-year waiting list, he was forced to pay for private healthcare, something that he was able to fund through fundraising. And only in the last week, Mr Deputy Speaker, I saw patients while working as a GP who had been advised of 2-year waits solely for their first outpatient clinic appointments at Glenclwyd Hospital. This bill provides a vital opportunity to level up healthcare to ensure that all of our constituents can access the best treatment as soon as possible. Thank you.